Hello, everybody. All right, we're going to work on Lab 11, spinal cord, peripheral nervous system, and reflexes. So here I'm on the first exercise. We have the spinal cord, and as usual, we have a list of structures and then functions that will accompany it. We have the epidural space, the dura mater, arachnoid mater, subarachnoid space, pia mater, central canal, and so forth. So as usual, it's usually just more efficient to go to the functions and then quickly scan down the list of structures, to match the function set. So that's what I'm going to do. All right, so A, myelinated axons that carry sensory information to the brain. All right, so sensory is afferent information. It enters the spinal cord from the peripheral nervous system and then travels upward to the brain to be processed. So those myelinated axons that carry sensory information to the brain, essentially to the central nervous system, to the brain, are the ascending tracts. So A goes with the ascending tracts. B, the myelinated axons that carry motor impulses away from the brain are the descending tracts. Okay, C, contains sensory neuron cell bodies. Well, in the peripheral nervous system, that would be a ganglion, and you only have one ganglion. You have to know up to, let's see here, halfway down the dorsal or posterior root ganglion. The dorsal or posterior root ganglion. That is where C, the region that contains sensory neuron cell bodies. Okay, then we have D, the area containing adipose that acts as a cushion for the spinal cord. That would be up here at the top, the epidural space. The epidural space on those models is that fatty region that surrounds the whole spinal cord. And you can see some blood vessels in there. So that is epidural space goes with D, or D goes to the epidural space. All right, these are then these innermost protective layer of the spinal cord, middle layer of the outermost layer. These are the meninges. All right, so we have the innermost protective layer of the spinal cord. That would be the, going from superficial to deep, DAP, dura arachnoid to pia mater. All right, that's the pia mater that's intimate with the spinal cord itself. All right, so E goes with pia mater. F, the middle protective layer, is the arachnoid mater. And then G, the outermost protective layer of the spinal cord, is the dura mater. Right, H, the space within protective layers filled with CSF. CSF, what they're talking about, the arachnoid space. It's a large region, we're between the arachnoid mater and the pia mater. So it's below or sub to the arachnoid mater. And you have cerebrospinal fluid. Not that you can't find it in the central canal also, but we're talking about between the layers, of meningeal tissue. Okay, I contains association neuron cell bodies. All right, that is found in the posterior gray horn or the posterior horn. K contains motor axons exiting the spinal cord. Right, those would be the anterior roots or the ventral roots. So about 4 or 5 down from the top, we have ventral or anterior root. That would be J. That contains the motor neuron. No, I'm sorry, I went down too far. Did I skip one? I think I skipped one. I'm sorry. The K that contains the motor axons exiting the spinal cord, that goes with the anterior or ventral roots. but the one above it, I'm sorry, I went from I and I jumped to K because, even though I have my glasses on, it gets confusing. J contains the motor neuron cell bodies. Those are found in the anterior horn or the anterior gray horn of the spinal cord. My bad, I'm sorry. L contains the sensory axons entering the spinal cord. Those would be the dorsal, or posterior roots. M transports nutrients and gases to nerve tissue and cushions the spinal cord. That would go with cerebral spinal fluid. And the interior tube, in the spinal cord filled with cerebral spinal fluid, that would be your central canal. That would be your central canal. Okay, so now we've kind of matched up all those functions, and some of them are more descriptions than they are functions, but in any event, that's how we match up the functions to that particular list of structures. Okay, after that, we're going to look at a slide, and I will during live Zoom, the histology, the limited histology that you have to know from this lab. I will turn the camera around and put a slide on the instructor's microscope and put it on the overhead so we can look at this peripheral nerve anatomy. Now, essentially, we have the same structures or connective tissue layers that surrounded muscle, but instead of calling it endomysium, paramysium, epimysium, it's endoneurium, perineurium, and endoneurium, epineurium. We should be able to maybe see an axon and a myelin sheath. When we go deep into, when we look at the endoneurium and we magnify the different axons, within one fascicle and their connective tissue layer around them. And I'm going to do my best to show you those, during the Zoom. I don't think perhaps one of the images that shows you, that are here on the course page, those images are good for some things, but again, there are other models that I use pictures of that are from the classroom. That's why it serves you well to come to the classroom sometimes to see the other models, because even though perhaps the images that have been there, that were taken by another instructor and might not include everything you need to know. Now, I will say that if you go and look at those, if you see those links to different subcategories, those are the videos I did last spring when we were going into quarantine. And that lets you see all these different models. So if you can't come to lab, look at those videos, those YouTube videos I have up there of me doing a review of those different models and what you need to know. Okay. So now, get ready, we're doing cranial nerves. Last week, I said I wanted you to memorize all 12 cranial nerves, at least the names of them, 1 through 12 in succession. So you know which one is 5, which one is 6, which one is 12, which one is 2. And to be able to identify those nerves on the brain model. Because now what we're going to be doing is not only perhaps pointing to the nerve on that brain model and asking you, identify that nerve or that cranial nerve, and it might be, let's say, trigeminal. If I'm pointing to the trigeminal nerve, I can also ask you, identify the sensory function of that nerve, or maybe the motor function of that nerve. In addition, I might also use other models in the room to represent maybe the sensory function or the motor function of that nerve. And that's mostly what the images, that are there under Lab 11 are referring to. So there are a bunch of pictures where you have what I call the naked dude on a plate, that little naked baby on a plate, and there's an arrow on the skin of the face. And, the subsequent card or answer to what the question is, all right, that would be trigeminal nerve, because that is sensory or facial sensation, gets carried on the sensory portion of the trigeminal nerve. So you have to know, identify the nerves on the models. From there also, what would be that nerve sensory and motor function? And then there are also going to be models that we use that represent or symbolic of sensory and motor function of a particular nerve. And it's sort of like that, the first lab we did when we looked at all the different organs, and you went through looking at kidneys and bladders and ovaries and lungs and the heart and so forth and so on, an artery and a vein, and you had to say, okay, what is that? It's an artery. What system? Cardiovascular. What cavity is associated with it? It's no cavity because it's not contained in any one. But the lungs, are part of that pleural cavity. So it's sort of like that, where we're going to use symbols, to also represent maybe a sensory and motor function of a particular nerve. So when we look at those, I'll bring that back to your attention. So we're going to go through those images as well. All right, so olfactory nerve. Remember when we were doing this in lecture, and I said one way, easy way, to memorize these nerves is to start by just learning 1, 2, 3, 4, 5, 6, which are the first 6 nerves, and then you do 7 through 12, and you just memorize the names of them. But when it comes to sensory and motor functions of them, because there are 12 of them, not all of them have significant sensory and motor functions, what we call, mixed functions like that are significant that you have to know. So, when you start identifying and practicing now, naming the nerve and then identify a sensory function or a motor function or both that it might convey, the first 2 are really easy and the last 2 are really easy. The first 2 cranial nerves are sensory only. The last 2 cranial nerves are motor only. Okay? All right. So, olfactory nerve, what is the sensory function? It conveys the sense of smell. And the optic nerve conveys the sense of vision. Over here, there's no particular motor function. And brain structure, we can actually kind of change that maybe and put maybe the model or the slide that might be representative of that olfactory nerve, or you can kind of keep it blank, because when we look at the other pictures, that are, associated with lab 11, we look at all those different images, we identify them there. But if you wanted to use this column that says brain structure and actually maybe cross that out and just put model or slide, because the taste bud slides for next week's lab, that is sensory functions or sensory structures and systems, the taste bud slides are going to represent taste. And taste is associated with cranial nerves 7, 9, and 10. So you might use that column for that purpose. If you have a question about it, log into lab tomorrow, and I'm sorry I'm getting this done a little bit late, and ask a question there, and then I can show you better. Once we finish next week's, this will kind of come together a little bit better as well. In addition, if you go to the bottom of this chart, it does provide you with, or we do provide you with, of the sensory functions. We list some of these sensory functions, and essentially in parentheses next to it is how many times you're going to use it, or you may use it in filling in, the sensory functions or motor functions in this chart. So let's say sensation to the throat, we only use that once. That's going to go with Glossopharyngeal. Facial sensations. But here, taste, and in parentheses 3 times. And that's because cranial nerves 7, 9, and 10 convey the sensation of taste, but just from different areas. Anterior 2/3 of the tongue, posterior 1/3 of the tongue, or the laryngopharynx and epiglottis area, which would be vagus nerve. So it does give you hints here, visceral sensation. You can use those precise terms, or I might use a slightly different term. Either one is going to be probably acceptable because it's going to be a multiple choice or true and false question. So, and the same with motor functions. It tells you how many times you're going to use it. Okay, so we did the first two cranial nerves. Smell is a sensory function. Vision is the sensory function of optic nerve or cranial nerve 2. All right, oculomotor, cranial nerve 3 is motor to eye muscles. It's also motor to what's called levator palpebrae, is the muscle that elevates the eyelid. It's also to the pupils to constrict them as part of the parasympathetic stimulation. But the primary one right now to know here is motor to eye muscles. Now, next week, again, when we look at the models, then we can identify on the model, like we did in lecture, which is superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique. The 6 muscles that attach to the eye and move it in different directions, are innervated by different cranial nerves. 4 out of those 6 are going to be innervated by oculomotor. But at this point, since we really haven't done the lab to see those muscles, then we just want you to know for the motor function, it's just eye movement. And the same with trochlear. The trochlear nerve, cranial nerve 4, is associated with eye movement also. It only innervates 1 muscle. And abducens 6, 2 more down, eye movement. It's going to be lateral rectus. So maybe you can write that in there next to trochlear, write superior oblique muscle, and next to abducens, write lateral rectus muscle, and next to oculomotor, if you want, you can write in, your superior rectus, inferior oblique, inferior rectus, medial rectus muscles, the other 4 muscles, or you can wait till next week to kind of tie it all together. All right, but they're all motor functions. You don't have to know any sensory function. You can just leave it right now as eye movement, eye movement, eye movement. Now, trigeminal nerve, cranial nerve 5, is the first real dual functions, mixed sensory, significant sensory and motor function associated with it. So the sensory component of trigeminal nerve is facial sensation. Its sensory function is facial sensation. So it conveys this touch, sharp and dull on the surface of the face. Its motor function is to muscles of mastication. Muscles of mastication. So maybe next to this, maybe if you want in that brain structure column, is right masseter and temporalis, because those are the 2 muscles associated with chewing. Okay, so now we've done 1, 2, 3, 4, 5, 6 cranial nerves. Let's move on to facial. Facial, the sensory function is taste from the anterior two-thirds of the tongue, or you can just put taste, it's fine. The motor function are the muscles of facial expression. And facial expression is different than the sensory component of trigeminal, which is facial sensation. Facial expression is a motor function. It means some muscles going to contract. So the muscles associated with that would be zygomaticus that we looked at. Of the ones you had to know, zygomaticus. Because it elevates the corners of the mouth and produces a smile. Okay, then we get to vestibulocochlear. Very minimal motor, so don't worry about any motor portion of this. But vestibulocochlear, again, when we look at the ear next week, this will make more sense. You have the vestibular apparatus and you have the cochlear in the inner ear. And the cochlea responds to the sensation of hearing. And the vestibular apparatus responds to balance and equilibrium. Okay. So the vestibular cochlear nerve conveys 2 types of sense, special senses: hearing and balance and equilibrium. Okay, we're going to move on to glossopharyngeal and vagus. This is where it gets a little more complicated, and especially in lecture, because we have to know a little bit more about glossopharyngeal and vagus than what the lab requires. All right, we know one of the sensory functions of glossopharyngeal is taste. It's from the posterior third of the tongue. It also conveys information, sensory information about blood pressure and blood gas levels, or we have on the bottom of the sensory function, it says blood pressure and gas levels in red. It says you use it twice. That's one of them. And it would be good to know that, especially for lecture, is that glossopharyngeal conveys that sense from your carotid arteries in the neck by, not far from your Adam's apple. And it also conveys in red there that sensation of the throat. So the surface, the back, the back of the throat kind of level with the tongue, where I said I was describing a gag reflex and how you perform that with a tongue depressor, that you scrape the back of the throat or you touch it, and that portion, that the sensory portion of this reflex is that you feel something to the back of your throat. And the cranial nerve that conveys the sensory information of feeling from other is glossopharyngeal. Now, the response to it is, some kind of gagging effect. That tests the motor composition portion of vagus. So that's what a gag reflex is. All right, so we have those two sensations in there. Well, actually three. We have taste, we have sensation of the throat, and blood pressure and blood gas levels. The motor portion is some swallowing and some speech. Swallowing and speech. It does help with swallowing. I said that it innervates what's called the stylopharyngeus muscle, which is in that same throat area, the oropharynx level with the tongue, but posteriorly, and there's a muscle there. When it contracts, it elevates that part of your throat so that you have some place for food to go when the tongue pushes up to the roof of your mouth and it pushes it backwards. So it does participate in swallowing, and it does participate in speech. It has glossomic, which means tongue, and pharyngeal, which is throat. So it participates in both of those things. Okay, now we're going to move on to vagus. Vagus baby, cranial nerve 10. It too participates in taste, but farther down in the throat, in what's called the laryngopharynx, and where your epiglottis is located. So it conveys taste. It conveys blood pressure and blood gas levels also, but from what's called the aortic arch. The aorta is in the chest. And remember, any sensory or motor stimuli, or signals that have to travel below the shoulders into the thoracic and abdominal pelvic cavities are going to be conveyed on vagus. Okay, so its sensory functions are taste. Now we've used that 3 times. We have visceral sensations, because it's the only one that, as I said, just described, transports or conducts any kind of sensory or motor stimuli to or away from the thoracic or abdominal pelvic cavities. And it also conveys, as a sensation, blood pressure and blood gas levels from a large vessel that's found in the thoracic cavity. Okay, then we go to motor. So motor function includes swallowing. Big part of swallowing, most of swallowing is going to be the vagus. We have heart rate, right? Because it's going to essentially inhibit the heart rate, but it stimulates the heart, or it has connections to the heart. It's also motor to digestive muscles and glands, because those are all in the abdominal pelvic cavity. So just by location alone, you should know that. And that's it. Okay, so we said the first 2 cranial nerves were sensory only. Last 2 cranial nerves, accessory and hypoglossal, are motor only. So the accessory nerve, no particular sensory functions. You can put an X through that box, I guess, and go over to the motor column. An accessory nerve innervates muscles that move the head and the shoulders. So that movement of head and shoulders at the bottom of the motor functions goes in that column. And maybe over to the right, put a note in there. The two muscles that you are able to identify, or have been taught that have some kind of movement to head and shoulders, will be trapezius and sternocleidomastoid. So maybe write trapezius and sternocleidomastoid over to the right in the far column, so to remind you. And then hypoglossal, motor only. It's associated with speech and swallowing as well. So now we've used swallowing 3 times, speech twice, hypoglossal, speech and swallowing. Okay. So as kind of complicated as that is, that matches up pretty well. The only other, sometimes the motor functions that we talked about in lecture that we didn't really talk about, in lab, are some of the motor functions of facial and glossopharyngeal to the lacrimal glands and to salivary glands. Those are good to know because that, therefore, when we consider the autonomic nervous system, is why the 4 cranial nerves associated with the cranial outflow of, within the parasympathetic division of your autonomic nervous system include cranial nerves 3, 7, 9, and 10, because they participate so much with digestion or salivation or lacrimation or pupillary constriction, which is going to be oculomotor. And so, that's why those 3 or 4 nerves are associated with parasympathetic function. Okay, then we move on to spinal nerves and reflexes. This is using a variety of models that reflect the reflex arc, or the 5 components of a reflex arc. We have those big plastic cookie sheet models, I call them, that show you a receptor, and then your sensory neuron to an interneuron to a motor neuron to an effector. And then we have a couple what I call spinal cords on a plate. They're rather large. They're about 16 inches by 24 inches, maybe not 24, maybe like 14 inches by 18 inches perhaps, but they're a great big model. And they too show you a receptor, a sensory neuron to an interneuron to a motor neuron and an effector. But when you get to the sensory neuron to the interneuron, you actually have a spinal cord there that shows you where the sensory neuron cell bodies are located in the dorsal root ganglion. Then it shows you the spinal cord with white and gray areas. So in the horns, you can see where you would find an association neuron cell body. You can see where the motor neuron cell body is located and then how it travels away. So those are really good ones to kind of practice on, not only identifying the structure and its function in the reflex arc, but you can see where their cell bodies are located. So when you have those questions, you're like, oh, well, this is what we're talking about, cell body, cell body, cell body. Dorsal root ganglion, posterior horn or posterior gray horn, or the anterior horn or anterior gray horn. Okay, so those are your 5 components of a reflex arc, and you match up, the structure to the phrase that describes its function. So carries an impulse from the CNS, or essentially away from the central nervous system, to the effector. Which component of the reflex arc is that? And that's your motor neuron. So right, motor neuron in that first gap area there. Which structure carries an impulse from the receptor to the central nervous system? That would be the sensory neuron. Carries the impulse to the motor neuron. That's the function of the association neuron or interneuron. The muscle or gland that responds to the stimulus, right, which is essentially coming from the motor neuron. That would be the effector. And then lastly, responds to the stimulus, creates an action potential in a sensory neuron. And we're talking about responding to a stimulus, some kind of change in the environment. That is the receptor. All right, so we're going to apply that to the other models as well. All right, number 5, compare and contrast the somatic reflex arc with the autonomic reflex arc and give one example of each. But we have we have multiple examples. We're just going to kind of fill in this chart. Somatic is the easiest division to start with because the somatic division, both the somatic and the autonomic nervous systems, are motor or efferent pathways, carrying motor impulses on motor multipolar neurons from the central nervous system out to some kind of target organ. And the difference is how many neurons are in the chain. The somatic nervous system just has one motor neuron leaving the anterior horn, but the autonomic nervous system is a 2-neuron chain. And what they communicate to or what they terminate on. What are the effectors of a somatic nervous system? Well, the somatic effector is just skeletal muscle. So you write skeletal muscle here for effectors for the somatic nervous system. And everything else is autonomic. So what do we write in autonomic? Cardiac muscle, smooth muscle, glands. Okay, then we look at examples of reflexes. So this is a little more, there are more examples, than just effectors for the somatic nervous system of reflexes that you should be able to name at least one. And I'm just going to tell you. So going down this list, the first somatic reflex is this flexor reflex, which is a pain withdrawal reflex. So put in there flexor reflex. The next that would go in there is this stretch or tendon reflex, we talked about that in the lecture class. And then we have our crossed extensor reflex. That's also a type of somatic nervous system. Okay, essentially everything else listed there that we did not put under somatic goes under autonomic. So peristalsis, right, that goes under autonomic because peristalsis is how we propel food through the digestive system, as well as how we transport urine from the pelvis area of a kidney to the bladder. Heart rate is another autonomic nervous system reflex. Blood pressure regulation, autonomic nervous system reflex. Both the pupillary and respiratory rates go into autonomic. Okay, so the only things that go into somatic are flexor reflex, stretch or tendon reflexes, and the crossed extensor reflex. The stretch and tendon ones are the ones that we, talked about in class. And I believe that's it. All right, well, that's it for filling out the sheet. I'm going to stop this share and I'm going to switch to where we can see all the different images. So let me change that and then go into, yep, it went to sleep. So hold on just one moment. Go back. There we go. It takes a little bit for it to reestablish that connection. So let me go into share again and see if it's there. Yep, there it is. Okay. So now I'm back on the course page and we're going to look at the images. First image. Okay, this is a picture of a very old spinal cord. Okay, I don't think any of my questions use this particular model. And that's why I said, look at the video, the YouTube video I have up there, because the model that we are going to use is one that's shown a few slides down, right? It's a newer model. You look at it, you're like, oh, that's a much newer model. This is really old. But this is the one that points to certain connective tissue layers of the meninges and the spaces. All right, but I use the other model that we're going to show in just a few slides. And I'm certain I use that when I do the YouTube video, that reviews all this, all these structures in the models. However, the key to 1, 2, 3, and 4, where we have an epidural space, we have subarachnoid space, we have the dura mater, arachnoid mater, pia mater at number 4. Dura mater, arachnoid mater, subarachnoid space, and your pia mater. I don't care for that model. I think it's more confusing. I'm like certain I don't use it. So, but I will point to the same structures, in the video. And if I don't know if you can see my little arrow as I move it around here. Hopefully you can see, I can point to it in a subsequent model, which is this one, which is much easier to see them because it's a newer model. All right. So here, number 1 is pointing to the epidural space. We said the epidural space has fat in the blood vessels there, cushions the spinal cord within the vertebral foramen, or the vertebral canal, so it doesn't get injured or bruised. It also helps insulate it. So wherever you see fat, all the way around, circumferentially around the spinal cord, that's the epidural space. The first grayish blue layer adjacent to that, and if you magnify this picture, that might be a G on it, but the next layer deep to it in kind of that light bluish grayish layer all the way around the spinal cord, that is your dura mater. Then you have a little kind of a gold little yellow line between that dura mater and the next deepest layer, which would be the arachnoid mater. And they're adjacent to one another, like two pieces of paper, and a little space between them. So G would be the dura mater all the way around. That little gold layer is, a space. Technically, it's a subdural space, but we don't identify that on a spinal cord. That is kind of a visual representation of just the difference between the dura mater layer and the arachnoid mater. So the next light bluish gray layer, again, surrounding the entire spinal cord, would be the arachnoid mater. Between that and the pia mater, which is the white layer intimate with the spinal cord all the way around, that's the pia mater. Between the arachnoid mater and the pia mater, you see that big trough kind of area? We call it the moat. It's like a big moat around the entire spinal cord. It occupies a region between the pia mater in white and the light bluish grayish layer of arachnoid mater. That's your subarachnoid space, and that's where we find the majority of cerebrospinal fluid. So I think this is easier to identify these. I know I have other images that I use, from another image database, to identify those, and that's why I do the video. And so you can see that. Okay, the other structures, now that we're looking at this, so those are just the meninges, the spaces of them, and the fluids that we find there. What are their functions? But we have the white matter of the spinal cord and the gray matter of the spinal cord here as well. And the gray matter is shaped kind of like two wings of a butterfly that are connected in the center. So the gray matter are considered horns. You have the posterior horn or dorsal horn. You have the anterior or ventral horn. You actually have lateral horns in certain regions of the spinal cord because that's where we find these cell bodies of the motor neurons associated with the autonomic nervous system, which would be thoracolumbar, would be part of the sympathetic nervous system. And then connecting those two in the center is called a gray commissure. But what you have to know is the whole of the center, which is the central canal. All right, so you're identifying the epidural space here. You can see epidural space, and then going from superficial to deep, epidural space, dura mater, arachnoid mater, subarachnoid space, pia mater in white around and intimate with the spinal cord stuck to it. Then we're looking at the gray matter, right? Posterior horn, anterior horn, central canal. And then we're going to look at some of the white regions here. And so we're kind of taking this in steps. So we have epidural space, just telling you that's where we have adipose tissue. So the functions are provided in the first exercise that we covered: the posterior horn, anterior horn, and your central canal. Remember, central canal is where we find cerebrospinal fluid. The anterior horn is, contains where we're going to find motor neuron cell bodies. The posterior gray horn, I don't know why he didn't put it in there. I think he just forgot. Is where we find the association or interneuron cell bodies. You can write it in there. And then here, we're looking at some of the other, nervous structures, that we find in here as well. So, we looked at the gray matter, but we didn't look at the white matter. So the white matter represents those up and down elevators that we're talking about in lecture, the ascending tracks conveying sensory information to the brain, or maybe some descending tracks carrying motor impulses that will eventually outflow from the anterior gray horn, to stimulate a muscle or a gland or something to contract. Okay, then we're looking at these nerve roots or ventral and dorsal nerve roots that you can see entering and exiting the spinal cord. And then also here, number 2, pointing to that bump region there called the posterior root ganglion. Right, so you get an orientation as to what's anterior and posterior, like the posterior or dorsal gray horns and anterior ventral gray horns, by either knowing the shapes of, the shape of the gray matter there and how you can tell. But on a model like this, you can see posteriorly that you have a spinous process. And then anteriorly here at number 1, you have a vertebral body. So that cervical vertebra, which this is trying to also give you orientation. The body represents the anterior aspect, and the spinous processes stick out posteriorly, right? So that tells you the gray portion of those horns of the gray matter, which is the posterior aspect and which is the anterior aspect or ventral aspect. And same goes for the nerve roots exiting and emptying the spinal cord. So number 3 are those little wires or nerve roots, leaving from the anterior ventral aspect of the spinal cord. Those must be motor neurons because they leave the anterior gray horn. And you know that because you've got the cell body right there, or the vertebral body, I'm sorry, right there at number 1. Number 2 continues as number 4, nerve roots that enter the posterior aspect of the spinal cord. And that's posterior because look, you can see a spinous process there. So those nerve roots travel enter into the posterior horns. Those are your posterior or dorsal nerve roots. And number 2, which are sensory neurons transmitting sensory information to the spinal cord and the central nervous system. Number 2 represents the cluster of their cell bodies in this one location, and that's the posterior or dorsal root ganglion. Remember, ganglion in the peripheral nervous system represents a cluster of cell bodies. And when those cell bodies all cluster together, they take up more volume, so they form a bump, essentially. And then they continue as sensory neurons, axons into the posterior gray horns. And of course, this is bilateral. Okay. So number 1 represents really white matter anywhere there where you see white matter. It's not just the tip of the arrow, it's any of that white matter of the spinal cord. Would be considered, where we would find the ascending and descending tracks. Ascending is carrying sensory information, descending is carrying motor information or motor impulses. 2 represents the posterior root ganglion. That is where we have the sensory neuron cell bodies located. It continues as posterior nerve roots. And then number 3 represents the motor neurons exiting from the anterior gray horn as anterior roots. Okay, next picture represents the histology of the nerve, trying to identify the different connective tissue layers that surround it. Remember that we have a perineurium, an epineurium, then a perineurium, and an endoneurium from superficial, middle to deep. Remember the epineurium, like an epimysium, is connective tissue that's capable of surrounding the entire nerve or muscle that you can see. So when you're looking at this particular slide, and that's when I go into live Zoom to you, on Friday afternoon, is if someone's pointing to myself, connective tissue that's to the outer portion of these three fascicles of nerves that you're looking at, these three bundles of a bunch of nerves. You have one fascicle to the top, one is about, at 12 o'clock, one at 3 o'clock, and a great big one, that's the majority of what you're looking at. Well, the stringy material that's capable of going around the entire circumference of all three of those to kind of bind them all together, that would be your epineurium. The connective tissue layer that's capable of only surrounding one fascicle, that would be your perineurium. And then the connective tissue layer that would surround one axon of a neuron, which is within one fascicle, but one of those fascicles here to the middle and to the bottom. I mean, that's one great big fascicle, but you have one above it and one over about 3 o'clock that are smaller. When we magnify that, you can see that there are all these individual axons of nerves that are found there. And surrounding each one is going to be in a connective tissue layer called the endoneurium. And we looked on that, we saw that on those motor neuron models that we covered last week. So to really identify that well, for you to really see it, which is what I'm going to do in lab, is that it really has to be magnified. But in theory, if you just point to something, let's say way down at about 7 o'clock, the connective tissue to the outside of that fascicle, when you look around, is capable of going around that whole big entire cluster of a big nerve with the composed of these three fascicles of nerves. That would be your epineurium. One of those layers, let's say between, these two upper fascicles here, that you can see some connective tissue layer that clearly can only go around one fascicle, then that would be an perineurium. And then anybody pointing to inside that one fascicle, the only connective tissue layer that could be found deep to a fascicle would be an endoneurium. But in class, I'm going to try to magnify that so you can see it, because they take up stain. They're pretty dark, and they look like kind of like a macaroni on end. And when you may see a motor neuron axon in the middle of that, which would be a black dot. And then the region between the black dot and the endoneurium would be the myelin sheath, the fatty portion surrounding that axon. So it's going to be very similar to that motor neuron model that you looked at last week. Now you're going to look at it on end, and you'll be able to see the endoneurium. You'll need to see an axon in the center. I'll try to find a good example in class. And then the region between the axon and the endoneurium is the myelin sheath, that yellow portion. Remember that, that's fat, and so it doesn't stain well, because fat, stains in histology, have to have some kind of a charge to them to interact with, the ions that are the stains in the stain, so they generally don't take up stain. Okay, this next slide, this does let you see some of that. I would magnify it actually one more time, or just a little bit more, but you're within one of those fascicles, and you can see sort of, especially over here, maybe about 3 o'clock, that's a pretty good representation. You can see within that fascicle, these little dark staining connective tissue circles. They kind of look like macaroni on end. And in some of them, you can see a little black dot, right? The round or the circular black or dark gray there would represent the endoneurium, and the black dot in the center would be one of the axons of a motor neuron, or the axon of the motor neuron that endoneurium is surrounding. And that pale staining region between the black dot and the endoneurium surrounding it would be the myelin sheath. So in class, I can show you much better, what that is. But even, if it's the question is what layer is, would be found in here, well, you only have one more layer. That's the endoneurium. If someone's pointing to the little black dot in the center, or myself pointing to, we're talking about the axon. If we're talking about the pale region, or pointing to that pale region between the two, then you're talking about the myelin sheath. So here, Dr. Raven just kind of created a drawing so you can differentiate between epineurium, perineurium, and endoneurium. So if it's a connective tissue layer, they can surround, more than one fascicle, go around the whole thing, then that's your epineurium. Here's two fascicles here that he's drawn with little dots in the center. So the connective tissue layer, they can certainly only capable of surrounding one fascicle with the perineurium. And then if you were asked a layer, quote unquote, within one fascicle, then that would have to be the endoneurium. To identify the axon of the myelin sheath, it would have to be greatly magnified, and now the black dot in the center of an endoneurium would be the axon, and then the clear region would be the myelin sheath. So just because he does, there isn't necessarily a picture identifying that doesn't mean you still don't have to know it. Okay, then we're attacking, we're almost done. We're going to go through these last models. I said that we used some of these models like we did in the first lab, that we had all the different organs, and then, you needed to know what system was associated with it and maybe what cavity. Well, we're using these models now to identify the cranial nerves associated with these things. Now, this will come together more specifically when we have the eye lab, which will be next week. We do the eyes and ears and taste buds and things then, but after that, it kind of comes together. All right, so here we're looking at an eye, and he's pointing to this number 1, which is this tendon. This is the tendon that's the superior oblique muscle. And over here, number 2 is pointing to lateral rectus. So again, this will come together, but right now, if someone pointed to number 1, that white tendon, or the muscle over to the side, they're asking you which cranial nerve would be associated with 1 and 2. And so 1 would be the trochlear nerve, and 2 would be abducens. 1 is trochlear, 2 is abducens. They function to move the eye. Right now, if you just put eye movement, or the selection is eye movement, that's fine. But by next week, now you'll know specifically, that is a superior oblique and that is a lateral rectus. And I think that makes it easier to then put together the nerves. You can study it now and get it over with, that's fine. Here we have another eye model, all right? And we're looking at the superior rectus muscle here. So it asks you, what cranial nerve? Well, superior rectus is innervated by oculomotor. Remember, oculomotor is going to be the most frequently used because it innervates, or it's the nerve supply to 4 of these muscles that touch the eye. He didn't show you the other muscles, but you have medial rectus, inferior rectus, and inferior oblique are all innervated by oculomotor. But we'll see that more next week. Okay, then we have, look at this muscle, arrows pointing to zygomaticus and masseter. Zygomaticus and masseter. And it's asking, hey, what cranial nerve might be associated with 1? What cranial nerve associated with 2? Well, it's pointing to muscles, so it's got to be some kind of motor function. Maybe the same cranial nerve, it may be different ones. And in this case, it is different ones. All right, so 1 is pointing to zygomaticus, and we said facial nerve innervates that. Now, facial nerve is cranial nerve number 7. It innervates the muscles of facial expression. Right now, that would be pulling up the corners of the mouth. It's the nerve supply to zygomaticus. It also, see, that was good. He put that in there. Stimulates secretions from your lacrimal glands, which are tears. We'll see that next week. And the salivary glands, some of the salivary glands to secrete saliva when we eat. Number 2 is pointing to the masseter muscle. If we point to the temporalis muscle, it too elevates the mandible. So those two muscles, masseter and temporalis, are innervated by trigeminal because they are chewing muscles. Okay. Here, pointing to the skin of the face. What cranial nerve? Well, the skin of the face would be sensation or facial sensation as a sensory function of the trigeminal nerve. Trigeminal facial sensation. That's its sensory function. All right, what cranial nerve might be associated with the heart or the large intestine, the small intestine? Does not matter. The pancreas, anything below the shoulders. That is going to be motor and sensory, or both conveyed on vagus. Conveys visceral sensation. It also is, the motor supply to these organs and smooth muscle of the tube systems that are passing through there of digestion, like the esophagus and the stomach and the small intestine, large intestine. Vagus also functions in taste, blood pressure, and blood gas levels. So how might you, point to that? Well, next week when we look at the taste bud slides, we're going to tell you them. When you're looking at a taste bud slide, we're talking about the special sense of taste. And we have 3 cranial nerves that convey that, 7, 9, and 10. Mhm. Blood pressure and blood gas levels, if we were, I was pointing to an artery, especially in the chest or maybe in the neck. If I asked you, name one cranial nerve that conveys, sensory information from these organs, you would respond glossopharyngeal or vagus. Right? And it would probably be as such. You might have glossopharyngeal A, vagus B, trigeminal C, or D might be both A and B, vagus and glossopharyngeal. I don't expect you really to know that, hey, that's a carotid artery in the neck and that sensory information is only conveyed on glossopharyngeal, and maybe the aorta in the chest, which is another big, a red tube, but those are arteries. That blood pressure and blood gas information is conveyed on vagus nerve only, as long as you understand that those are the two, and so regardless of which one was the vagus or glossopharyngeal, and if you want to know for sure, you can, but it would probably just be more generic like that. Just know that both vagus and glossopharyngeal are the 2 cranial nerves that convey sensory information of blood gas levels and blood pressure from arteries in the neck and in the chest. That would be sufficient. Okay, now we're looking at, look at that, sternocleidomastoid, or perhaps behind that, trapezius. What cranial nerve would be associated with that? It's got to be a motor function of somebody. So that's going to be, whoops, it's not even done anymore. That would be your spinal accessory or accessory nerve, cranial nerve 11. Accessory nerve. Sternocleidomastoid, it is motor to sternocleidomastoid and trapezius. So you could point to trapezius and sternocleidomastoid, or just sternocleidomastoid alone. Identify the cranial nerve associated with it. It could be accessory nerve. And then here we're looking at the tongue. So when we use generally the tongue model, we call it the alien tongue model because it looked kind of like the alien from that movie in the 80s or whatever, 90s, the alien, the Sigourney Weaver. Right. We're not talking about taste. We'll use the taste slide, or I will use the taste bud slide for taste. But when we're looking at the tongue, we're talking about speech and swallowing type of thing, speech and swallowing. That kind of motor function, because you really look at the muscles of the tongue here. So we have hypoglossal, speech and swallowing. You could put glossopharyngeal because that has to do with speech and swallowing. Yeah, because it does work with the tongue, but really hypoglossal, and I'll just tell you that speech and swallowing, use more than just 2 or 3 cranial nerves. It is a group effort, so to speak, because it's very complicated. But when you see generally that tongue model, just give hypoglossal. That's probably the best answer for you. And that's probably the only answer that I provide for you. Would you be technically wrong by saying glossopharyngeal? No, not really, because they kind of interact together, but I would just go with hypoglossal. If the question was, hey, name all the cranial nerves associated with speech and swallowing, all right, now you're going to start, using hypoglossal. You could say glossopharyngeal. Vagus isn't really associated with speech, but it is swallowing. So, you kind of have to look at that question and what it's actually asking you specifically, and then look at the choices that were provided with you. Because if really just want, something like speech and swallowing, then you probably speech and swallowing be given hypoglossal and glossopharyngeal. If it was just swallowing, then you'd probably be given hypoglossal, glossopharyngeal, and vagus. So you kind of have to look at it, but I don't think anything is going to be quite that specific. Okay, then we start looking at the models, for the reflex arc, and this is what I call that big cookie sheet model that's in plastic. Number 1 begins with your receptor. 4 is the sensory neuron. I'm sorry. 1 is the receptor. It's 2. Why did I say 4? I don't know. We go from 1 to 2, which is the blue neuron here. All right. That is a sensory neuron, because we start with the receptor, responds to some kind of a stimulus. Right. It creates an action potential on the sensory neuron. The sensory neuron carries that impulse on the blue neuron to the central nervous system, to the posterior horn, where it synapses with number 4, which is your association or interneuron. Now, if we had more arrows with 5s and 6s and 7s and 8s, we could have put this all on one model, and label up the one, but we don't have, our arrows don't go up that high. So we do about maybe 3 to 4 on one model and a couple more on the other. 3 is pointing to the cell body of a sensory neuron. And you should know that the location, or where would I find 3, which are the cell bodies of sensory neurons, those are located in the posterior root ganglion. And likewise at number 4, here you have your interneuron or association neuron. Right? Where are the cell bodies of 4 located? They're located in the posterior or dorsal horn or great horn. Okay, so we have the sensory receptor. We're looking at components of a reflex arc. Sensory receptor, the sensory neuron. 3 is pointing to the cell body, the sensory neuron cell body. That's what SNCB is for. And they're located in the posterior root ganglion. And then we have our interneuron or association neuron. And you should know where its cell body is located as well. Should have really written in here, cell body found in posterior horn. Now, the other reflex model is going to show that a little bit better, so be patient. Right now, we're labeling up the remaining portions, or of your reflex arc. So we have our association neuron or interneuron in the blue here. It then synapses with number 1, which is the motor neuron. 1 is pointing to the cell body of that motor neuron, which is found in the anterior horn or anterior gray horn. And number 2 represents the whole motor neuron, as a unit. That conveys an action potential away from the central nervous system and terminates on 3, which is the receptor. And the job of the receptor is to, in this case, is pointing to skeletal muscles. So it would be to respond to the stimulus, being generated by the motor neuron. And in this case, it's to contract. If it was a gland, it would be secrete whatever secretion you form. But it's to respond to the stimulus of the motor neuron, essentially. All right, so we have number 2, as I said, is talking about the whole thing. That's your motor neuron. 1 is kind of specifically pointing to the cell body of that motor neuron located in the anterior horn. And then last of the reflex arc is your effector. And you said know the difference between somatic versus autonomic, but I don't think I asked you that. But I would ask you, hey, what is the function of number 3? And you go, okay, it's pointing to, an effector. So you go back to, where we identified filling in the blank, matching the component, the component of the 5-component reflex arc. You take a particular component, you match it to the descriptional function that's there, and that's what you would answer. So just let me go back one, and just say, look, if I pointed to number 3 here, and I said, hey, identify number 3, you would say, oh, that's the effector, because we're talking about the 5 components of a reflex arc. Or if I asked you, hey, what's the function of number 3? Or down here at number 2, what's the function of number 2? Well, the function of number 2 is, transport or transmit impulse away from the spinal cord to an effector. What's the function of the effector? Respond to a stimulus. In this case, it would be contraction, but it's going to be more generic, than, just like contract. It might be contract or secrete something. Generally, it's going to be just respond to the stimulus. This is that other model I said that also identifies the 5 components of a reflex arc. But in doing so, you can see where the cell bodies are located of the neurons, and then you're like, oh, now I see how I'm going to know where these cell bodies are located, not just because we talked about it in a lecture, but because, oh, I can see it actually on a model. So you have number 1, you have number, which starts with a receptor. Those are those like little green nubbers in there at the skin. So that would be a receptor. Then we have number 2, which is the yellow neuron. That's a sensory neuron. And 2 is pointing to where your cell bodies are located. The cell bodies are those little round balls. So that's the cell body of a sensory neuron. And that bump region is your posterior root ganglion. Then it connects and enters into the posterior horn, gray horn of the spinal cord, and synapses with green, the association neuron. The little spiky region there, of the cell body of the neuron is found in the posterior horn. So cell body association neurons are located in the posterior horn, where it's synapsing with that sensory neuron in yellow. Then the association or interneuron carries the impulse to the anterior horn, where it synapses with the orange cell body of a motor neuron. So motor neuron cell bodies are located in the anterior or ventral horn. Then it conveys on the orange an impulse away from the spinal cord. So number 4 is pointing to the motor neuron, and then it terminates on an effector. In this case, it's skeletal muscle, all right? And what's the function of an effector? To respond to the stimulus. So we have the sensory receptor, the sensory neuron, the association neuron or interneuron, your motor neuron, the effector. But what's good about that model is you can see where the cell bodies are located. So you go, oh, that's why they keep saying sensory neuron, sensory neuron cell bodies are located in the dorsal root ganglion. Oh, I can see the bump region there. Yep, that's the dorsal aspect or the posterior aspect. Association neurons are found in the posterior horn. Yep, I can see them. Motor neurons are found in the anterior gray horn. Yep, that's the anterior gray horn. I see the motor neuron cell bodies, and then it transmits away. So I really like that. Now, you can then take that information, apply it to that plastic cookie sheet model, And now when you look at that Kudishi model, the first reflex arc model we looked at, okay, now I understand what they're asking by pointing to maybe just the motor neuron cell body on that blue neuron, and they ask where is it located. Okay, well, now I know where I'm talking, what they're talking about. This, I'm not sure. Okay, these are sheep brains. You can look at them on your own. I don't use those for testing purposes. I don't even really use them much. They're so kind of degraded and they really stink and it gets on the clothing that I hate using them. But if we had human brains, it would be great. So you don't have to know that. But also, the nerves often pull off of them, so you only can see a few of them. They're just not very good examples. Okay, so that is it. That is the end of the lab. We looked at the how to fill in the sheets. We looked at all the images here. You need to look at the. I'm going to stop the share in just a second. You need to look and review those videos I have up there. So under Lab 11, we have, you have the document, this document that we just filled in. Below that, I have spinal cord and meninges. And you see that link? That means it's a link to a video. Reflex arc, it goes to a video. Cranial nerves, labeled, that goes to, that has an image. But in doing all this, I'm pointing to those cranial nerves on those models. I did that last week, I believe, as well. That was part of it. And now we're putting those sensory and motor functions to it. All right. So you need to know those. So don't ignore and think I'm not going to point to a brain model now and maybe ask you, what is that, that nerve sensory function or the motor function? Because now you should know and be able to identify, hey, that's cranial nerve 3, which is oculomotor, or that's cranial nerve 12, that's hypoglossal, or that one's 11, accessory nerve. You should also be prepared for that. Okay, so I'm going to stop the share and I'm going to close out the this lab and I'm going to upload it on the course page for your review. I apologize for getting this done a little late. I had a whole bunch of other things to grade and some student issues in a couple of the classes and things. So I had to try to calm people down and regroup everybody. So if you need more time, well, the quiz on this really isn't due till next Thursday, but if you did not get a chance to review this and we have lab tomorrow because this is Wednesday today and you didn't get a chance, that's fine. I'm going to stay in there if you want to take some time and you want me to go over some of these things in more detail again, which I normally don't do when we live Zoom like that. I will and make an exception kind of here because, clearly you didn't have a lot of time to review this. But also next week, remember, you can always come into class. I encourage you to do that because it makes learning these models easier. And you only have to come in for you can come in for 5 minutes, you can stay there for 2 hours. But, don't let this go too far because looking at those brain models really helps you learn those cranial nerves, very, very quickly. So, and you are responsible for them. Or you can come next week. Next week's lab is the last lab. And then the following week is your third exam. Bam, that's it. So try to come this week or next week, please. All right, so thanks for coming. And I'm going to close this out.